Hello pharma guys, welcome to our channel Easy Learn Pharma. Today I am going to discuss about the difference between the pharmaceutical suspension and pharmaceutical emulsion. Because maximum time the question will be arrives regarding the difference between the pharmaceutical emulsion and pharmaceutical suspension. So now I am going to discuss about that part. Okay. Okay, so pharmaceutical emulsion and pharmaceutical suspension. So my dear students, first of all, you should know regarding the definition of pharmaceutical emulsion and pharmaceutical suspension. Okay, first definition part. So my dear students, all of you know that these two dosage form are the biphasic liquid dosage form. Okay, why? Now because in the emulsion two phases are there and in the suspension also two phases are there. That's why it is a biphasic liquid dosage form. And it is also a biphasic liquid dosage form. Okay, it is a biphasic liquid dosage form and it is also a biphasic liquid dosage form. Clear? And the second point is the second definition part. So the pharmaceutical emulsion is a biphasic liquid dosage form containing two immiscible liquids. Okay, containing two immiscible liquids. One is oil phase, another one is the water phase. Oil and water. Okay, so the pharmaceutical emulsion is the biphasic liquid dosage form in which or containing two immiscible liquids are there. One is oil phase, another one is the water phase, or you can say one is the dispersed phase, another one is continuous phase. Okay, the pharmaceutical emulsion is a biphasic liquid dosage form containing two immiscible liquids. One is continuous phase, one is dispersed phase, another one is the continuous phase. These two immiscible liquids are not mixing for longer period of time. So in that time you have to add some emulsifying agent to miscible with each other. Okay, so in the pharmaceutical emulsion, to prepare the pharmaceutical emulsion or to miscible the two phase or to miscible the two immiscible liquids, oil and water, you have to use the emulsifying agent. But in case of pharmaceutical suspension, it is also a biphasic liquid dosage form. Okay, so the pharmaceutical suspensions are the biphasic liquid dosage form in which the very finely divided solid particles are uniformly dispersed throughout the dispersion medium by using the suspending agent. That means in that case the two phases are there. One is solid particles, another one is liquid medium. Okay, so in that case, in the pharmaceutical suspension, the two phases are there. One is solid particles, another one is the liquid medium. And in the pharmaceutical suspension, okay, to uniformly disperse the solid particles, you have to use the suspending agent. Use the suspending agent. Okay, so in the pharmaceutical emulsion, to miscible the oil and water, you have to use the emulsifying agent. And in the pharmaceutical suspension, to uniformly disperse the solid particles, you have to use the suspending agent. Clear? And in the pharmaceutical emulsion, two phases are there. One is dispersed phase, another one is the continuous phase. And in the suspension, also two phases. One is dispersed phase, another one is the continuous phase. But in the pharmaceutical emulsion, according to the type of emulsion, okay, according to the type of emulsion, which one is the dispersed phase and which one is the continuous phase. In the pharmaceutical emulsion, those person having small amount, okay, that means you can easily say small amount having the dispersed phase, that is the small amount having the dispersed phase, and large amount, okay, large amount having the continuous phase in the pharmaceutical emulsion. But in case of pharmaceutical suspension, always solid particles act as a dispersed phase, okay, and liquid medium always act as a continuous phase. Clear, my dear students? Now come to the point. In the pharmaceutical emulsion, it is of two types. One is oil in water, another one is water in oil. Okay. But in case of pharmaceutical suspension, it is of two types. One is flocculated suspension. Another one is deflocculated suspension. Okay, so it is of two types. One is flocculated suspension, another one is the deflocculated suspension. Okay, two types. It is also two types. Okay, in the pharmaceutical emulsion, oil in water and water in oil. Oil in water, that means oil is the small amount and oil is the dispersed phase. Water is the large amount. Water is the continuous phase. And in the oil in or in the water in oil, water is the dispersed phase, oil is the continuous phase. But in this case, always solid particles act as a dispersed phase, liquid particles act as a continuous phase. Clear? Now, the method. Okay, now the globule size of the pharmaceutical emulsion 0.25 micron to 25 micron. Okay, but in the pharmaceutical suspension, that is 0.5 micrometer to 5 micrometer. Okay, that is the particle size of the pharmaceutical suspension. Okay, particle size of the pharmaceutical suspension 0.5 micrometer to 5 micrometer, and the globule size of the pharmaceutical emulsion 0.25 micron to 25 micrometer. Now, how to identify the pharmaceutical emulsion? Now, by using so many tests. Okay, one is dilution test, dye test, okay, conductivity test, and fluorescence test. That is test. But in case of pharmaceutical suspension, test is rate of sedimentation. Okay, so in the pharmaceutical suspension, one evaluation test is that is the rate of sedimentation. But in case of pharmaceutical emulsion, how to identify the emulsion? Now, by using the dilution test, dye test, fluorescence test, and conductivity test. Okay, now in the pharmaceutical emulsion, there are three types of methods are there. One is dry gum method, second one is the wet gum method. Okay, dry gum, wet gum, and bottle method. But in case of pharmaceutical suspension, only trituration method or colloidal mill is used for the preparation of pharmaceutical suspension. Clear? Next, last one is the example of pharmaceutical suspension and the example of pharmaceutical emulsion. The pharmaceutical emulsion example is castor oil emulsion, turpentine oil emulsion, okay, arachis oil emulsion, and liquid paraffin emulsion. But in the pharmaceutical suspension, paracetamol oral suspension, okay, that is paracetamol oral suspension, okay, and in this case, that is liquid paraffin emulsion. Okay, so these are the difference between the pharmaceutical emulsion and pharmaceutical suspension. Okay, and another thing, in the pharmaceutical emulsion, the globules are not sedimented on the surface. But in case of pharmaceutical suspension, the dispersed phase, that is solid particles, sedimented on the surface. Okay, that's why before you use the pharmaceutical suspension, you have to shake well proper. That's why you can take the accurate amount of dose. Clear? Thank you very much, my dear students.